Syphilis+Treponema+Pallidum. By Lena Mueller. Background information. Syphilis is a sexually transmitted disease, STD. It is caused by bacteria. Syphilis can be transmitted by sexual contact and also by a mother to her baby when pregnant. Syphilis can infect the genital area, lips, mouth or anus. Geography, statistics, trends, and population. Syphilis is found all around the world and in the United States is often a problem in the South as well as urban areas. Men who have sex with a same-sex partner are more likely to contract syphilis. From 1990 to 2000 the amount of those with syphilis decreased, but after 2000 that percent began to increase before beginning to decrease again in 2010. Geography, statistics, trends, and population. The age with the highest rate of syphilis as of 2010 is those between the ages of 20-24 years and 25 to 29 years. African Americans have the highest report of syphilis with 16.8 cases per 100,000. Although syphilis is most commonly found in men with male sexual partners, there are also cases involving men who have female sexual partners. Rates of syphilis. Primary syphilis. The first stage of syphilis and it is the most treatable. The first symptom is a painless sore found on the genitals, rectum, or in the mouth. The sore is known as a chancre and it forms about 3 weeks after syphilis. The chancre can go unnoticed because it is usually found inside the rectum or the vagina and no pain is felt. The chancre goes away after 6 weeks. Chancre. Chancre on penis. Secondary syphilis. Occurs about 3 weeks after the disappearance of the chancre. A rash that begins on chest or abdominal area and later spreads to the rest of the body. Bumps that look like warts also form on the genitals or in the mouth. Symptoms also include fever, muscle pain, sore throat, and lymph nodes that are swollen. Symptoms dissipate in a few weeks, but can come back and dissipate again for a year. Rash found in secondary stage of syphilis. Latent syphilis. This stage has no symptoms. Occurs if syphilis is not treated. In some symptoms never return and the syphilis lays dormant. In some cases the person with syphilis moves into the tertiary or the late stage of syphilis. Tertiary syphilis. Occurs in about 15 to 30% of patients that do not get their syphilis treated. Symptoms of this stage include damage to the brain, nerves, eyes, heart, blood vessels, liver, bones and joints. This stage may not occur until many years after the contraction of syphilis. Congenital syphilis. Babies that are infected with syphilis while in the womb often become exposed to the disease by the placenta or during birth. After a baby is first born, symptoms are often not seen, although a rash may be present on the palms of the hand or on the soles of the feet. Symptoms seen later on in a child's life include deafness, teeth deformities, and a collapsed nose at the bridge. Prognosis. The prognosis is good for those who are treated in the early stages of syphilis. As the disease progresses it becomes harder to treat, and although the treatments do work, organ damage from the syphilis can often not be repaired. Prevention. Use a condom. Be in a monogamous relationship or abstain from having sex. Avoid situations or things that cloud your judgment and lead to unprotected sex, such as drugs or alcohol. Diagnosis. Blood can be tested and antibodies that fight infections can be looked at. The antibodies that attack syphilis stay in the body for many years and can indicate past or current infection. Fluid from the sores can also be scraped and studied under a microscope to find the bacteria that is known to cause syphilis. A spinal tap can be done to collect spinal fluid if the nervous system may be affected by the syphilis. Treatment. Penicillin is often used to treat syphilis. The penicillin is most effective if the syphilis is caught early. 1 dose is all that is needed if caught before a year of having syphilis. After a year additional doses may need to be given. Penicillin can even be used in a late stage of syphilis, but it cannot fix any of the organs that may have been damaged due to the syphilis. After treatment. Follow-up exams and blood tests to make sure the dose of penicillin was enough. Abstain from sex until the syphilis has been confirmed to be cured. Tell any other sexual partners. Get tested for HIV, and syphilis. Those who contract syphilis have a greater likelihood of contracting HIV. The chances of contracting HIV increase 2 to 5 times as much as a person without syphilis. Sores caused by syphilis bleed easily, allowing HIV to enter easily into the body. Neurological. During the late stage of syphilis, neurological symptoms can develop. These symptoms include stroke, meningitis, deafness, visual problems, and dementia.